Good morning. Hi, this is Steve Sabadeski, BayouBuzz.com, and I'm pleased today to have Treasurer John Kennedy on a Hangout webcast interview, and along with an associate of mine, Wayne Nix, who is from Yountsville, if I'm not mistaken, Louisiana. Treasurer Kennedy, good morning to you, and I know we have 15 minutes, so we have a lot on the plate, and we might have some people who might want to ask questions or comment. Good morning to you. And
good morning to you, Stephen, and to Wayne.
Thank you so much. 2 years ago, we did a Google Hangout interview, and so we're going a little bit further with this with the webcast.
Steve Sabadeski, Bayou. Sorry about that.
Okay, I think there was a window open. So, having said that, what I want to ask you first, if you don't mind, is to you've written a number of different op-ed pieces. One, of course, being about a number of these reserve funds that have been depleted, and if you could at least take us through that, tell us about these reserve funds that some of them have like almost $500 million. At least one of them had $500 million, and now is close to being depleted. So please go ahead and tell us.
As you know, Steve, we're spending more money than we take in. That means they've got to fill the hole some way. They've either got to raise taxes, or they've got to cut spending, or they've got to resort to accounting maneuvers. So they've resorted to accounting maneuvers. And one of the things they've done is spend all the taxpayer money in the state's savings accounts. For example, they have spent about $500 million in the state's health insurance program. We're self-insured for health insurance. Retirees and employees pay money in to the fund. The state matches it. It had about $500 million in it a year or so ago. At the rate they're spending, in short order, it'll be down to zero. The state had, a few years ago, $850 million in a savings account or a trust fund we had set aside for health care for the elderly. We were supposed to leave the principal alone, invest it, and spend the interest. They spent all of that. At the end of this fiscal year, that $850 million will be zero. Basically, what the state's done is spend more than it's taken in, and try to fill the hole by cutting higher education and spending all of the money in our savings accounts.
I thought that we were supposed to live between our means. I thought that we're not supposed to use a credit card.
Well, we're not. We're not under the Constitution.
So
and our biggest problem, obviously, we have a number of budgetary issues, but our biggest spending issue is health care. We're spending about somewhere in the neighborhood of $9.5 billion a year out of a $25 billion budget on health care, and we're not doing much to contain that cost. It goes up 2, 3, 4, 5, 6, 7% every year. I know you've read the stories about all the things that have been done by DHH to save money, but I don't know where the money is being saved, because every budget I look at every year, the spending goes up anywhere from 3% to 6 or 7%, and they have achieved that extra spending by cutting our universities. We need to do some wholesale reform in our healthcare delivery system. What we've done so far is help, I guess, but it's not really solved the problem.
I see. Now, we're waiting to find out from the Obama administration regarding our proposal to them in Medicaid. What if we get a no from the Obama administration in terms of the funding of those hospitals?
Well, there is no plan B. Our plan A is in effect. We've got to make it work because there is no plan B. In order for plan A to work, we need the blessing of the federal government, the Centers for Medicare and Medicaid Services. So far, the center has refused to give us its blessing. We don't have much information. The negotiations are going on between the Department of Health and Hospitals and the federal government, but I can tell you it's very important that we make it work because there is no plan B. There is no plan B. We've privatized the charity hospitals. I think the good news is that the quality of care is better. I truly believe that. I can't prove it, but I believe it based on anecdotal evidence. We haven't saved the money we thought we would save. I can tell you that. Maybe the savings will come later. I certainly hope so. But so far, we haven't saved any money. In fact, we've spent more money than we were spending.